What about lifestyle changes? How about activity? Can these people, if they ache all over, can they really walk or run or swim? What do you have them do?
If they can get into a water therapy program, that is the most effective therapy, I think, warm water therapy. Even if they're just walking in the water, they'll feel better. But they have to increase their activity gradually. They can't go from 0 to 60 because then they'll feel terrible, they'll quit, and they won't do anything else. So even if they're doing steps, I say add 100 steps a week. You know, everybody likes their Fitbits now, and their smartphones are all counting their steps, so that makes it easy for that. But they have to work up slowly because initially they will have more pain. Aerobic exercise, low impact aerobic exercise tends to be the most effective. I do have a subgroup of patients that like the weightlifting. If they stay in the gym and they do weightlifting, they feel better. That's a minority. But the swimming therapy, I think, is by far the most effective.
Are they afraid to start? I ache all over. I can't get out of bed. I ache so much I can't go out and walk. What do you say? You encourage them? You've got to do it?
I do, but that's on an extreme end of fibromyalgia. Most people, I don't think, realize most fibromyalgia patients are fairly functional. They get up, they go to work, they take care of their kids, they learn to deal with the pain. When you get to the patients who really can't do anything, there's a lot of emotional issues going on generally as well, and depression, and I think that's a separate issue. Those patients tend to be sicker.
Women, in my estimation, frequently learn to hide complaints, such as aching all over and not feeling good. And you're telling me there are a lot of people out there that should be seeking help because of they ache all over and they're just not willing to complain? Or are they willing to complain?
Well, a lot of patients I see will come in and say, well, I've been aching for 10 years, it's just gotten worse now. And the ibuprofen's not working anymore. So is there anything else?
So when they say the normal pain relievers are not working, how do you go? There's no laboratory test, so that's when you start ruling out things, and you tell them that there are medicines. You give them encouragement. Tell them to be active. You like warm water. Why warm water? What is there a reason?
They hate cold water. Fibromyalgia patients, if they swim in the pools where the kids do swim team, they hate it.
So does jacuzzi help? That's the only warm water thing.
They love jacuzzis. Actually, therapy centers have warm water pools for therapy. And usually once you've done their therapy, you're usually allowed to continue going there, just paying a price after you finish the physical therapy in the warm water pools.
So warm water pool is in a physical therapy
setting rather than a
YMCA?
Yes.